All right, thank you, Dr. Woodson. This is Stein Bronsky, and I'm the Chief Medical Director for Colorado Springs Fire Department and El Paso County AMR in Colorado. We are very lucky in Colorado Springs to have a fantastic medical community that was willing to take this on as a community-wide project for the betterment of patient care. And so I'm just going to go through a little a summary of the process that we went through and how and why we chose Pulsera and what has happened with that. Our community, just to give people a baseline of understanding, is Colorado Springs is about 450,000 people within the city limits, and about 675,000 actually in the surrounding metro area and county. We have 4 major hospitals that belong to 2 hospital systems. One of them is a university system, and we have over 50 feeding EMS agencies into all of those hospitals, many private and fire-based. We have approximately 60, I was putting that on the low end just to make sure I wasn't overestimating, but it was about 68,000 medical, solely medical 911 calls last year. And so we have the same problems that Dr. Woodson talked about with communication. I think they're universal. When you're dealing with a lot of different hospital systems, with multiples of agencies, with different technologies, and the communication between EMS and the hospitals, as well as the way that the hospitals communicate inside themselves, is to be desired. Sometimes there are little pathways that have made fantastic adjustments and have really made it very smooth, but in general, it's just like the slide that was shown earlier, where you have this one link in the chain that breaks, and then the whole system breaks down, and what ends up suffering is the patient. And so we decided as a community that we needed to create a uniform and seamless communication system that spans from curbside EMS to the hospitals all the way through definitive care, and then ideally would give all of that feedback downstream again to EMS for loop closure. That was a big task, and we saw that Pulsera was going to potentially offer and has offered what we think is a fantastic solution. We had many challenges, as I'm sure everybody who's listening in is thinking, well, we can't do that because of X, Y, and Z. I can guarantee you we had the same problems. We have multiple EMS agencies all under different control, all deciding how they were going to do what they were going to do. We had 4 different hospitals, and even though they only belong to 2 hospital systems, each hospital individually is very different, with different management, different service lines, and this all created very inefficient communication. There also was the challenge of who do you go to in the hospitals to present this and to get their buy-in, because every service line within the hospital is not the same. Cardiovascular service lines are different from the neurosciences, different from the trauma, and they all operate in their own silos. And one of the other big challenges we had was that there's obvious competition. The Centura Health System is one system we have out in Colorado Springs, and then the University of Colorado is the other one, and they are hugely competitive with each other. And so sometimes, as you can all imagine, it's difficult to get them to be on the same page because they can't get over the competitive aspect of patient care. And then there's just the holistic theme of change. Anytime you bring change into a situation, people are resistant. And so we had a lot of barriers to overcome. And where we decided to start on this was to get everybody around the table, and thankfully we had a forum to already do that that was guided by EMS, where we get all the hospitals to sit down together and all the service lines to sit down together and give us reports to EMS so that EMS could better figure out how to serve the community and where to deliver patients, etc. And so through that forum, we started to have discussions with both of the hospital systems to promote the idea of creating an environment of collaboration among all the different hospitals in our community for the betterment of the community and for betterment of patient care. And if we can get all of EMS and all of the hospitals on the same page with this, then we can, as a community, probably affect patient care better than any individual little project that's going on. And so we decided as a community that this was going to be an all or nothing event. We were either going to get everybody on board or scrap it. We wouldn't have actually scrapped it, but that was my original goal. It was my Hail Mary that I put out there and said, let's all sit down and talk about it. So first, the hospitals were difficult in some ways to talk to about this and easy in other ways, because the neuroscience lines would absolutely loved this idea, because their service line is more in an infancy than the cardiovascular service line. Stemi is very streamlined in a lot of communities, and they have a very, very fixed way of doing things, and they feel as though, if you're anything like our hospitals, they felt as though their system was near perfect, and they really weren't willing to sit down initially and talk to us about the fact that there might be something out there that can help with their efficiency. But the neuroscience lines were very different. They understood that they weren't as developed as cardiology, that they could benefit right out of the gates from this type of technology and communication from the field. And so our hook in our community was originally with the neuroscience lines. It was also important for us to go to the hospitals and say that the administration needed to have buy-in on this, because we felt as though we could not come from EMS and say, we want the hospitals to do this, and guess what? You get to pay the money for it because it's free to EMS. We had to sit down with the hospital administrations and make sure that they felt as though this was going to be a worthwhile concept to them, and that their return on investment would be something that they were willing to take on. Thankfully, after our initial discussions, both of the neuroscience lines from the two hospital systems came back and said, yes, we do believe that this will really help, and we're willing to put the finances there out on the table for this. We were also able to show them, and I think this is one of the reasons that they grabbed at this concept, was we were able to show them where they were going to save finances and FTEs in the hospital because of implementing a system like Pulsera was going to streamline the communication and the information gathering that has traditionally been done by somebody sitting behind a computer and with a phone and spending hours and hours a day on end gathering all this information for the service lines, and to say nothing about how they gather the information to then hand back to EMS, which we all know is extremely inefficient. And we could save all of that with Pulsera. We also had to have large conversations with the IT services in the hospitals. That ended up to be a very large portion of what the implementation was, to make sure that each IT system in the hospital was set up, was communicating, was not blocking Pulsera, etc. And again, our goal was to get all 4 of the major hospitals up online all on the same day. And so for EMS, the concept was a little bit easier to sell, although we still had the issue of several people or several agencies saying, no, we feel as though what we do is just perfectly fine. We don't need anybody to help us. And so that just general concept of change was something that we had to overcome. Also, there were some agencies that are not technical at all. They don't have smart devices. They would use flip phones. They weren't interested in using anything else except the radio, and so we needed to overcome that with the EMS agencies. As far as getting the EMS agencies started, once we passed the concept of making this change and they were able to acquire and figure out the rules of usage for the end user applications on smart devices, we were actually able to get all the core 19 EMS agencies in our city and surrounding area started all on the exact same day. And the training was so easy that it literally took 5 minutes to train somebody up on how to use this. I was expecting that there was going to be a lot of resistance, especially age resistance, meaning the older population of EMS providers were going to be very, very resistant to it. I call them the non-tweeting population, but actually it ended up that everybody embraced it very, very, very quickly. This just goes to show you, we started this in July of last year, and right out of the gates we had, and this was for Stemi activation, and this is a conglomerate number for 2 of the hospitals out there, where 88% right out of the gates, 88% of the Stemi activations made by EMS were made through Pulsera, and that was right out of the gates. Then we had a little bit of slump in August as we brought more of the EMS agencies on board, and people were really learning it. And then you can see that in September we shot right up to 100%, and it's remained ever since September between 99 and 100% of activations are made through Pulsera. You can also see here, this is CVA activations with Pulsera. In July we started with 75 and we went up to 88 and then 96. And some people may ask, why is it not 100% all the time? And we still do deal with some geography issues in Colorado, where if you're behind a mountain and you literally cannot communicate by wireless network, that you have to use repeaters off of the top of mountains to be able to get information to the hospitals. And so those activations, the very few of them would be done by radio, and then they would feed it into Pulsera as soon as they came into communication view. The benefits are tremendous that we've discovered so far. I kind of divided this out. The benefits on in the emergency department is that with the advent of Pulsera, we can get HIPAA compliant information on the patient and be able to pre-register them from the field so that we can have everything ready. We can save all that time when they get to the hospital. Doctors can already look up information on the patient's records. We can also monitor the patient's care, which we were never able to do before. Through Pulsera, we can find out what stage the EMS crew is at, and we can also monitor what's happening as far as the activations through these service lines in the hospital, because everybody reports in through Pulsera. So we know if there are people that have not communicated back, something that we would only find out later after the fact when things really went wrong before we started using Pulsera. One interesting thing that we were not expecting but has been a huge benefit is that we all understand from the hospital side that when a patient is called as an alert in the field, for instance, a stroke patient, we clear the CT scanner and we wait for the EMS crew to arrive. But sometimes there are hiccups, sometimes they don't arrive in that standard 5 minutes that's been reported. And what we're doing is we're essentially stopping flow in the emergency department so that in anticipation of somebody coming in that's going to need the scanner. Well, with the GPS on Pulsera, we can actually track where the crews are. And so we can time the exact clearance of the CT scanner or of teams or bothering physicians to look at certain aspects of the alert. We can time that down very, very, very specifically, and it saves a lot of ED flow and just interfacility flow, and that's something that we weren't anticipating that's been a great benefit. And then as you put all this together, you can see how by using the Pulsera, we're able to very systematically start the process of bypassing putting patients into emergency department rooms and putting them directly into the CT scanner or taking them directly to the cath lab. And so we're really starting to cut down on that. For the neurosciences, this is wonderful because we can actually transmit pictures that the neurologists can see in the field. And so they don't even need to wait to have the patient arrive at the hospital and to get that information from the ED doc. It also, as I mentioned, it improves the efficiency of use of the personnel and equipment, and then it improves the patient flow. And it has shown across the board to decrease time to CT scan and intervention. Here's a graph of two of the hospitals, and you can see about 3/4 to the right there's a green line that is vertical, and everything to the left of that line is pre-Pulsera. Everything past that line is post-Pulsera use. And then this is the mean door to CT scan time, and it's dropping precipitously as we're using Pulsera more and more and finding all the nuances of how we can use it. And so that is hard data that we can definitely show that's improving patient care. As far as interventional cardiology is concerned, one benefit is that because all of the information that comes through Pulsera right from the field goes all the way up the service lines, the interventionalists can see the EKG the second that the emergency department does, the second that anybody does, and they can, and they like getting that information. We can also, as I mentioned before, we can decrease the ED time or even bypass the emergency department in certain cases because the entire cath team and the interventionalists have already been activated. It was all done in that one seamless click of a button. So and one other thing is that the university has reported, and they just gave me these numbers yesterday, but they've reported that they have a 65% decrease in the amount of patients that are getting to the cath lab and getting wires placed, meaning that 65% of their patients are getting there faster than they were pre-Pulsera. And for the cardiovascular service to come back and say that is really amazing because they're the service line that typically felt as though they already had everything all squared away as far as communication was concerned. So if we go on to this next slide here where we talk about the benefits to EMS, and I'm sorry I accidentally put emergency departments here, but it's really the benefits to EMS is that it's minimal to no cost. And I say minimal because sometimes we had services that did need to buy smartphones, that weren't using smartphones. But the end user applications for Pulsera, and as far as Pulsera is concerned, it's all free to the EMS agencies. It basically eradicated in one fell swoop any of the time discrepancies that we had between EMS agencies and the hospital times of alerts. We would always come back and kind of battle out, well, how long did it really take to get this person from the time that this was active, the Stemi alert was activated to the time they got intervention? We could never agree with EMS. EMS always had different times that they had alerted that the hospital was saying was different, and that affects the way that you report numbers. And with the advent of Pulsera, that just completely vaporized, and we don't deal with that issue anymore because everybody is on the same clock. The other thing that was amazing to me was that there was little to absolutely no resistance from EMS across the board. Rural agency, urban agency, volunteer, professional, it didn't matter. Everybody just immediately adapted to using the application because, in all honesty, it's modern. It's what we use anyway. And the big thing that we don't talk about often with Pulsera that I really want to emphasize here is that we get, as EMS, we can get immediate feedback on a patient. We're still working out some of the details, but what Pulsera will do is that as people log this information into their system in the hospital, and then they close the case, all of the information has been placed into Pulsera by everybody, including the interventionalists, and then that information is automatically fed straight back downstream to the front-end users, the curbside users, which are the EMS crews that brought the patients in. And so quickly are going away the days where we would have to have a EMS liaison spend all of their time figuring out what happened to a patient, if it was actually an appropriate alert, what was the intervention, how did the EMS crews do. That is completely getting taken care of by implementing this, by implementing Pulsera. And then obviously, to kind of close out my statements, is that who's the real benefit of this that we all really care about is the patient, because the patient simply gets faster and better care. Or I should say they get to the really good care faster, because we already feel as though we have good care, but they get there much faster, and ultimately with time being tissue, that is benefiting all of the patients. So where do we see that we're going with this? Because I can already see this planned out. We've actually had EMS crews that like the Pulsera system so much that they try to communicate through it without having an alert. Meaning when we first started the system, we just said we're going to start with the Stemi and we're going to start with the CVA. But the only thing that the EMS crews are supposed to be communicating through Pulsera are those types of alerts. But we have so many of the people out there in the field that have taken to this technology and basically said, no, I want to use this just to ask some general questions. I want to get this EKG to a doctor right now. I don't want to be relying on a fax machine and somebody having to look at the fax machine and me call in and say, hey, I'm sending you something. We have the doc look at it. They send in these EKGs, for instance, and they just say, hey, what do you think about this? Should we treat it this way? Should we treat it that way, etc.? And what we realized very quickly was this is EMS actually pushing to use what Pulsera has now implemented, which is their general alert, where we can alert the hospitals about any patient, ask any questions, give them any information. And so it's actually turned out wonderful, because instead of us having to go and say, okay, well now we're going to start the general application, we already have people that have figured out a way to use it without even being told that we're starting it. And so our next goal here in the next few months is to be completely up and running with the general application so that the EMS crews can transmit all patients, all information to the hospitals and not use the radio. The radio will still be there as a backup for the meantime, but our plan will be into the future that this would completely take away, kill the radio, and provide more modern-day communication. And so it has been an absolutely wonderful experience. It hasn't been without its challenges. Pulsera has been extremely helpful in working through all of the feedback that we've given them. We've handed them a bunch of quagmires that they take back and are figuring out the bugs so that it will fit our system, and it's just been wonderful. And we've definitely passed the tipping point. There is no moving backwards from this in our community. Everybody that moves in, we have a new hospital that just opened up, and it wasn't even a question. We basically said, you've got to start using Pulsera. Here it is. And so they're working on implementing, going through the process of implementing that. And we've just made it a community-wide system that we do believe is going to continue to raise the bar in patient care. And with that, I think I will fold up.